Good day, ladies and gentlemen. Thank you for joining me on this edition of the program You and Your Health and on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. HIV and AIDS prevalence is increasing rapidly among women of reproductive age, and it has become an important contributing factor to high morbidity and mortality. The need for all women to know their HIV status and understand the importance of HIV prevention is primordial. Right now, let's go on a short break. I will be right back. Today, we will be discussing on the effects of HIV on pregnancy, and I'll be receiving as guest Dr. Ako Chanel. She is a medical practitioner. Good day, Doctor. It is a pleasure having you on the program today.
Good day, once more. I'm happy being in your presence today, too.
Okay, Doctor, before we dive on the effects of HIV and AIDS on pregnancy, I want you to briefly explain to us what exactly is HIV and AIDS. We know the month of December is dedicated to persons suffering with HIV and AIDS, especially the 1st of December when we recently commemorated World AIDS Day. What exactly is AIDS?
HIV, AIDS are actually two different diseases. As HIV is the virus, and then it could gradually progress to AIDS. So this is the virus where people commonly have it from the normal routine means we know the sexual intercourse use of infected objects that infect the bloodstream, diminishes our immune system from fighting other diseases, as a result progressing gradually to AIDS. So that's just summarily what HIV AIDS is about.
Okay, so how can HIV be transmitted?
HIV can be transmitted first vertically from the mother to the child, horizontally through the normal means we know, that's blood transfusion, use of infected objects, sexual intercourse, if it's found in blood and in semen. Am I missing out on something? I think summarily that's it. So you have both vertical transmission from mother to child, horizontal transmission through having unprotected sex from an infected person, use of infected needles, syringes, and blood transfusion, to a minimal extent, kissing if the person has a wound in the mouth.
Okay, so today's program we are going to be focusing on the vertical means of transmission. So what happens when an HIV positive woman is pregnant?
Okay. First, most women don't even know, let me not put it like women, most people don't even know they are positive. So you have about 6 million persons in the world, not only in Africa, not only in Cameroon, globally, that don't even know their status. And it's quite disheartening that maybe a lady who is pregnant comes for her normal antenatal clinic and discovers she's positive. She's pregnant and she's positive. You know, it's quite a disheartening situation because she has herself to take care of, and she has this newborn baby, talk less of her partner at home who might not know his status as well.
Okay.
So in this case, we are handling two persons at the same time. So now we routinely test pregnant women who come for antenatal visits for HIV alongside other infections, so we are able to identify children who are at risk.
Okay.
Yes, exactly.
So now, are there extra risk for any pregnant woman who decides to go in for a cesarean?
Cesarean section. In our setting, we rarely tell pregnant women to go directly for cesarean sections because there are many we have so many means we can use during pregnancy, during labor and delivery that we do to prevent the risk of transmitting it to their babies.
Okay.
But then, if we are able to know the viral load of these mothers, the CD4 counts of these mothers, to know that, okay, your viral load is too high, and the risk of you having a vaginal delivery, the risk is higher transmitting it to your baby, then we go in for a cesarean section. But then it saves the baby to an extent, but the mother as well has, alongside all complications of surgery, maybe poor wound healing, which she might face, and high risk of other infections that come along with it. But not every pregnant positive mother is encouraged to go in for a cesarean section. They are capable of delivering normally, vaginally, and having healthy babies.
You talk about the viral load being high. What can cause a viral load to be high? Are there some major causes, or it's just natural?
The viral load just determines the quantity, the amount of virus the patient has in the blood system.
Okay.
So certainly, if you aren't compliant to your antiretroviral treatment, meaning you don't take your medication they give you, because during pregnancy, or if you knew your status before you got pregnant, we expect you to take your treatment regularly. If you're diagnosed during pregnancy, we advise you to take your treatment regularly as well. So if you don't take them as expected of you, it's normal that your viral load goes up. The CD4 count, which are the cells that fight other infections in your body, goes down. So as a result, you're just an open book or an open door for viruses to just keep coming in and coming in and coming in.
In such a case, we know a pregnant woman is fragile. Don't you think such drugs could have a side effect on the baby?
Yeah, like every other medications, we have side effects for them. And with antiretroviral, such side effects could be the normal nausea, the tiredness, the vomiting. To an extent, they have renal failure. To an extent, they have anemia. To an extent, they have liver diseases. But I think when we weigh the benefits of the medication to the harm, obviously we prefer to give the mothers, because first, giving these medications is to improve the health of the mother and ensuring she's able to give birth to a child who is not infected.
Okay.
So when we weigh those things, it's quite beneficial for her to take it. And the children as well are encouraged, because after delivery, be it positive or negative, we place these children on medications as well.
So is it immediately after these children are being are given birth to, or it's after a while that these children are placed on medications? Immediately
a positive mother gives birth to her baby, these babies are introduced to antiretroviral immediately. And maybe the testing based on the environment you find yourself in, very equipped hospitals where the DNA of the virus is identified. Within 4 to 6 weeks, they are tested to identify if they are positive already. And it's quite important to tell the population that every child born to a positive mother already has the antibodies of the HIV virus. Meaning, if you're doing a kind of test we call serology to identify the antibodies, they will come back positive, but it doesn't necessarily mean these children are positive. Okay. So that's why we don't want to wait till when we say they are positive before we give them medication. We place them immediately on antiretroviral so as to limit the risk of infections to these children.
Okay. To participate in the program, you could call us through the following numbers: 655-51-1111. I repeat, 655-51-1111 or 652-025050. 652-025050. You can call and participate and ask some of your questions which have been bothering you when it comes to HIV pregnant women. And Dr. Chanel Ako, who is a medical practitioner, will be answering all those questions. Back to you, Dr. Chanel. Why is it not possible for a doctor to tell if a child is positive immediately after birth? Why is it after 2 weeks? You talked about 2 weeks, right?
You have 2 weeks, you have 4 to 6 weeks.
Okay.
Best to do the testing.
Why can't it be done at the same time when the child is just like given birth to?
Well, it's not it can't be done. It's because we expect normally, under normal circumstances, the maternal blood and fetal blood don't connect with each other. That's how supreme God made it. Okay. But then it may be during pregnancy, maybe during delivery days and exposure, we will need the virus to multiply.
Dr. Chanel, we'll be coming back to you.
DNA.
We have a call on the line. Hello? Hello? Hello, who is on the line? We just lost that caller. Back to you, Dr. Chanel.
So we will need to have the DNA to be able to identify. So we need the accumulation of these so we can use whatever instrument we want to use to identify it. Like I said, every child exposed to an HIV mother already has the antibodies, but it doesn't mean the child is infected. What we need to do is to identify the DNA of the virus, where we do the polymerase chain reaction, which is a kind of testing done to do that. So within weeks of delivery, we are able to determine if the child is positive or not.
And now, is it very, or let's say, healthy for... We have another caller on the line. We come back to that question. Hello? We just lost that caller. So now, back to my question. Is it healthy for, let's say, a lactating mother to breastfeed the child?
Okay. We have what we call exclusive breastfeeding. That is to say, it's okay if you know you would do that alone without feeding the child with maybe artificial milk or any other thing.
Mm-hmm.
So we say exclusive breastfeeding means you don't give water, you don't give artificial milk, meaning from morning to night the child is only fed with breast milk. Because once you start doing mix and then there are lesions in the gut, there is risk of transmitting the infection. So it depends on the mother. You discuss with them, especially in our service, in our communities where cost of buying artificial milk is a problem. We always encourage mothers, people with middle class, low class people, it's okay to feed your babies as long as you're not giving artificial milk to these children or even water.
Don't you think we are putting the child's life at risk, coupled with the fact that we know some children are like, they can bite the nipple, and we know how such can occur? Or don't you think that's another way of transmission?
Well, with everything there is risk because it's like telling a lady who barely earns 10,000 francs at the end of the month and tell her, okay, madam, I think you just have to give your child artificial breast milk. Immaculate, I don't know how much. You know how much giggles or French leg costs, and a child eats about 2 tins of that in a month.
Very
and the mother can afford.
Exactly.
You're already risking the child a lot. But with breast milk, they don't buy. It's safe, it's healthy, so safe to an extent. I think when we weigh both, it's more preferable to encourage. In a setting, I think in the Western world, some of them go directly to artificial milk. Nobody is being breastfed. But when we come here, we have to be sure these people can afford, and it's always available for the child.
Okay. There's no doubt that sexual intercourse is very important for a pregnant woman. In such a case, in case the woman is positive and her partner is negative, is it advisable for her to continue having sexual intercourse without putting on a condom or protecting each other? Or do you think there's still a risk?
Well, with pregnant women who have negative partners, it's quite important. You're not only wearing the condom to protect your partner, but protecting yourself as well from further infections. So whether your partner is positive or negative, it's quite encouraging to wear your condom. If your partner is negative, normally replace their partners on prophylaxis treatment that will prevent them from having the virus as well.
When you say prophylaxis treatment, does it mean in case you sleep with an HIV positive lady and you are negative, would that treatment immediately take it, you're fine?
If you're
you are infected, even if you were infected in the course of maybe having sexual intercourse or there was a blood contact or something of that sort?
Were you positive already?
No, in this case, you're negative and the lady is positive, and you've had, you just say you had intercourse with that person, let's say within 1 or 3 days, and after the 3 days you take the treatment you just talked about. Are there high chances that you can be fine without HIV or whatever?
Well, with people who have been exposed on unsafe sex with infected persons, we give them the prophylaxis within 72 hours. Like you said, within 3 days, these people should have received the medications, because studies have proven after these, the medications don't work. It will no longer protect you from getting the virus.
Okay. Thank you so much, Doctor. That was Dr. Shinal Ako, a medical practitioner right here in the city of Douala. It was a pleasure having you on the program. And for you, ladies and gentlemen, thank you for your keen attention. Stay in the company of more programs on Equinoxe Radio and television. So long.